So we know that some of the barriers for parents in getting their children vaccinated is concerns around safety. So I just wanted to share a little bit of information, more recent information. First of all, now at this point, more than 20 million children between the ages of 5 to 17 have received at least one dose of the vaccine. And the safety profile has just been very good, very positive for the Pfizer vaccine among these age groups. So here's what you need to know. Serious side effects have been extremely rare. And although that there has been some concern about myocarditis, it's extremely rare in both the 5 to 11-year-old population, as well as the 12 to 17-year-old population. And all cases, for the most part, were very mild and self-limiting. And in fact, the data show that in looking more closely at the 12 to 17-year-old population, that the risk of myocarditis from COVID infection, from getting the infection itself, is much more likely than the risk of myocarditis from vaccination. We know a lot of parents are concerned about possible developmental side effects, which there's no evidence of developmental side effects with these vaccines. We also know one of the myths out there that's been perpetuated is that the vaccine can cause reproductive or fertility issues. And I really want to reassure you that no reproductive side effects or fertility issues have been seen. The vaccination is supported by professional healthcare associations like the American Academy of Pediatrics, who say that reproductive side effects from vaccination are extremely unlikely. And in fact, a new study that was just released last week showed no reproductive side effects from the vaccine, but also confirmed that there were reproductive side effects from COVID infection seen for males. And so once again, the infection itself is riskier for reproductive side effects than the vaccine. Also important to know, the vaccine can be given at the same time as other childhood vaccines. And one of the concerns we know that people have shared is that the vaccines were developed quickly, but they were not developed quickly. At this point, we're 2 years into COVID vaccine research, which was built on a vaccine that had previously been in development for 10 years prior for the SARS and the MERS viruses. And scientists have been working for many years to develop vaccines against viruses like the one that causes COVID-19. So the COVID-19 vaccine that's available for children has gone through the same approval process that's required for other vaccines, including our routine childhood vaccines. None of the clinical trial steps were skipped and no corners were cut when it comes to safety.